Today we're going to be performing urinary catheterization on males and females. What we would do first before we enter the patient's room is we're going to perform hand hygiene. That's what you always do before you enter a patient's room. Next, we're going to verify there's documentation for the procedure to be performed, documentation by the physician. Once we verify there's documentation, we'll gather all our supplies that we're going to need. We're going to need a cath kit, and we'll need a couple of bath blankets. We're going to also provide privacy for the patient by either closing the door or closing the curtain where the patient's bed is. We're going to introduce ourselves to our patient, and then we're going to ask for the patient's two identifying factors, their name and their birth date. Once we do that, we're going to explain the procedure to them and why we're performing it for them today. Next, we're going to apply our gloves, and then we're going to cover the patient up with bath blankets. For a female patient, we'll have two bath blankets, one for each leg. And for males, we just have one bath blanket that's just covering their legs from about the thigh down, and then have one above their abdomen. Okay, so we're going to make sure that we are in a good working position, so we can we'll raise the bed, and then we'll make sure that the bed rail is put down. Then we're going to put the patient into a supine position. This is for both males and females. And with females, they need to have their knees extended. And for males, they don't even need to extend their knees. All they need to do is keep their legs flat and have their thighs, their hips externally rotated. So that is for males. And so we can have the patient covered up. Okay, this is the time that we're going to take. We're going to perform perineal care. When we perform perineal care, this is for to get rid of gross contamination. When we're doing that, we're just checking to see if where the urinary meatus is on a female, and also for a male as well. Once we perform perineal care, we're going to discard our gloves, and we're going to perform hand hygiene, and then we're going to don a new pair of gloves. Next, we're going to get our kit. We can have the kit either with the patient on the bed, which is preferable depending on the patient, or we can have it on the table next to the bed. But we have this patient is good, so we're going to keep it on the bed with the patient. We got to make sure to keep a sterile environment with this kit. What we're going to do is we're going to take out our kit. We can also use this bag as our trash. Since we don't have a trash can, we're going to act like that's our trash can. Okay, so whenever we're getting this sterile kit, it's a sterile field, so we need to get it from the tips. Touching as little as possible because it's a sterile field. And our gloves are going to be on the bedside table. We're going to act like this is our bedside table because they can't touch the sterile field. And we're going to place the drape with the shiny side down underneath the patient's buttocks. Now, we're going to discard these gloves, and we're going to perform hand hygiene. And then we're going to put on our sterile gloves. We're going to act like this is a separate table. Making sure that only that nothing touches anything. So we're going to act like this is a separate table. Keeping a sterile field while we put these gloves on. Next, we're going to drape the perineum, making sure that the hole is right above the perineum. Next, we're going to arrange all of our supplies. Our lubricant. We're going to open this and we're going to place them on the kit. Have our swab sticks. We will open these. We'll place them on the kit as well. We have our syringe. And here's our catheter in the bag. Now, we'll make sure that this clamp is in the lock position. So here's an unlocked. We're going to clamp it in the lock position. This isn't so urine doesn't come out whenever the urine is passing through the catheter tube. We're going to place our syringe. Actually, what we're going to do first, we're going to take this off. Make sure to keep it in the sterile field, of course. I'm going to trash this. Make sure that's a trash can. Next, we're going to take off the lid of our syringe. Put it in the trash can. Going to attach it. We're going to check to make sure that the balloon inflates. And it does, so now we're going to retract it. Just making sure that there's no holes in the balloon. Okay. Now, we're going to lubricate the catheter. For our females, it's about 2 to 3 inches, so we're going to act like there's lubricant here. In males, it's about 6 to 7 inches. Putting lubricant on the catheter. Okay. Now we're going to cleanse the meatus. We're going to also perform it on a male first. Okay, so how we do this, with our non-dominant hand, we're going to grab the penis just below the glands. And now this is contaminated, so we have to use our left hand has to stay on the penis. We're going to use our, and if the patient was uncircumcised, we'd have to pull back that foreskin, but the patient is circumcised. So how we're going to cleanse the penis is we're going to use our swab sticks. Grab on the first swab stick, we're going to clean from the inside to the outer. In a circular motion, we're going to discard one. We're going to do this 2 more times, so a total of 3 times. That's for cleansing the penis. Okay, so we're going to act, now I'm going to show you with the female. With the female, we use our non-dominant hand, and we're going to separate the labia. And now this is this hand is contaminated, so you have to keep this hand here. You're going to make sure that you're able to see the urinary meatus. That's the one on top. You're going to grasp the lubricated catheter. You're going to ask the patient before we even do that, we're going to before we do that, we're going to clean it. We're going to get a swab stick. We're going to clean from the side that's close to us from the urinary meatus, from the clitoris down to the rectum. That's what the first one. And you're going to discard it. You're going to get the second one. You're going to clean from the clitoris on the side furthest away from you down to the rectum. And then you're going to discard it. And then you're going to get your last one, and you're going to clean from the middle, top, all the way down to the rectum. That's your cleansing. Now, we're going to insert the catheter. Going to grasp it about 2-3 inches below the catheter. We're going to ask the patient. Going to say, "Can you take a deep breath in for me?" And while and then once you exhale, going to have you exhale And then I need you to act like you're making a bowel movement, and we're going to insert it through the urinary meatus. Once we insert it, we're going to look for urine to go into the catheter. Once we see urine in the catheter, and we're going to slide it in just a little bit more. Once that's the case, now that it's in, we're going to have to get the syringe now. So now, since the catheter is in, we're going to take our non-dominant hand that's holding the labia, and we're going to let it go, and we're going to grab the catheter. And we're going to use our dominant hand to insert the fluid from the syringe. This isn't so the balloon will inflate. Once all that water is inserted, that means the balloon's inflated. You're going to take this hand and you're going to tug on it just a tad bit, just to make sure that it's in there. And once you know that it's in there, then you just put it up just a tad bit more once it's in there. And that's all there is to putting it. So we're going to act like it's already in there. And now we're done with inserting. So what we'll do is we'll take off our gloves. We're going to perform hand hygiene. I'm going to throw these away, and we're going to perform hand hygiene. And then we'll don on a new pair of gloves. And we're going to also make sure to put the catheter to the patient's leg. For a female, we can put it on their, we can attach it to their leg. For a male, it can be their upper thigh or their abdomen. And then we're going to make sure that the bag is placed on the bed side below the bladder. And then what we'll do is we'll wipe off the remaining lubricant and from the perineal area. And then we'll get the patient back into a comfortable position, with their blankets and everything back on them. Make sure that they have their call light in case they need anything. And then we'll discard all of our supplies. And then I'll remove my gloves and I'll perform hand hygiene. And then I'll document everything that we've done today, including the size of the catheter, how the patient tolerated the procedure. And that's all there is for applying to insert a urinary catheter for a male or a female patient. Thank you so much.